Good afternoon. Today we are going to talk about the Trauma Recovery and Empowerment Model, otherwise known as TREM.
A brief history on TREM was that it was founded in the early 1990s at a community connections facility that is a mental health and substance abuse service in Washington, D.C. Over 20 clinicians worked together to create TREM. They received feedback and participation from consumers who participated in the first TREM groups. They incorporated their advice and comments into the new version of TREM, which was finalized and published in 1998. TREM is based on 4 core assumptions, the first being current dysfunctional behaviors that result from trauma. The second is repeated trauma that causes reduced coping skills. The third is trauma that leads to damaged interpersonal relations. And the fourth is abuse that leads to feeling of powerlessness.
Thanks, Mackenzie. So what is TREM? TREM is a group therapy that's specialized for women who have experienced trauma, and it focuses on empowerment, trauma education, and skill building.
Does anyone know who TREM works for?
TREM was designed for women who have experienced physical, mental, emotional, or sexual trauma,
And consequently suffer from mental health issues such as substance abuse or PTSD.
But when doesn't it work? Since it's specialized therapy for such a specific group of people, it doesn't really work for anybody outside of that group of individuals.
For example, questions like, what does it mean to be a woman, don't necessarily help men who are experiencing trauma. Areas of risk.
The first sign we should look out for is the loss of emotional control. This could be somebody who becomes anxious in public situations.
And another one would be depression. This person, if you know that they suffer from depression, they would also be benefiting from TREM.
The third sign to look out for is dissociation. This could be somebody who's distancing themselves from others or losing focus.
The next one would be substance abuse. If you know someone that's suffering from substance abuse, they would also be in an area of risk.
And the fifth sign to look out for is a negative outlook on the world and themselves. So this is somebody who doesn't really have any positive outlook on anything anymore.
And the sixth one is, I'm going to put relationships. That was really bad. Because this person suffers from maintaining really healthy personal relationships. And we made this little web bubble to help you know that the areas of risk, this is what you should look out for people that would benefit from using TREM.
So, in TREM therapy, therapists use a bunch of different techniques such as cognitive restructuring, skills training, psychoeducation, peer support, and contained exposure.
The technique that's used for TREM consists of 24 to 29 total sessions, at least one per week, that's 75 minutes long. The TREM focuses on 3 sections that we talked about earlier, with 10 total subjects each section. So each session consists of 3 to 10 group members and has 2 to 3 co-leaders. So here are the 3 sections that we talked about earlier for TREM. And I have some of the examples of each topic section. So 2 of the topics for empowerment are what it means to be a woman and physical boundaries. For the trauma section, there's a topic that focuses on abuse and relationships. For skill building, they work on decision making and self-destructive behaviors so that they can be further able to identify these in the future and prevent them from happening.
The current literature for TREM therapy is kind of sparse right now, but the studies that have been conducted show that there's a lot of potential to help the women who have been abused using TREM therapy. The women in the studies were more likely to have reduced symptoms of trauma, reduced symptoms of comorbid disorders like PTSD or substance abuse, and reduced feelings of anxiety after experiencing TREM therapy. They also had increased feelings of personal safety and an increased ability to function on a day-to-day basis.
So this is Lydia. She has experienced sexual abuse, and after that she decided to cope with substance abuse such as alcohol and drugs. And after that she started distancing herself from her friends and family. So since they noticed that she was distancing herself from personal relationships, they recommended her to TREM. And TREM taught her empowerment, skill building, and trauma education. And after 8 to 9 months of that, Lydia reduced symptoms, increased personal safety and the ability to function, and now she's a happy and safe girl.